Hello and welcome everyone. Welcome. How is everybody? I'm gonna give you guys a couple of minutes for everybody to get on. Welcome everybody. Welcome. All right, my name is Phyllis and welcome to Florida Training Academy. And today we're going to be doing induction to diabetes for CNA. Welcome everybody. Welcome. All right. And then at the end, we're going to have a diabetes practice quiz. Hi. Hey, Miss Marla. Good afternoon. Good afternoon, everybody. Welcome. Hi. All right. Introduction to diabetes for CNAs. Introduction to diabetes for CNAs. All right, let's go ahead and get started. Like I said, my name is Phyllis and welcome. We're going to be doing introduction to diabetes for CNAs at Florida Training Academy. Good day. All right, let's go ahead and get started. All right, welcome to today's lecture on diabetes. As CNAs and nursing students, you will likely encounter many patients with diabetes. So it's crucial to understand what diabetes is, how to recognize its signs and symptoms, and how it's treated and managed. We will also explore the complications that can arise if diabetes is not well controlled. What is diabetes? Diabetes is a chronic medical condition that affects how the body processes glucose, sugar, the main source of energy for our cells. Normally, the pancreas produces a hormone called insulin that helps glucose enter cells for energy. In people with diabetes, the body either doesn't produce enough insulin or cannot use insulin properly, leading to high levels of glucose in the blood, which is hyperglycemia. Types of diabetes. Type 1 diabetes. The body does not produce insulin. It is usually diagnosed in children or young adults. Patients with type 1 require lifelong insulin therapy. Types of diabetes 2 through 3. Type 2 diabetes. The body does not use insulin properly, insulin resistance, or doesn't produce enough. It is more common in adults and linked to obesity, inactivity, and poor diet. Type 2 can sometimes be managed with lifestyle changes, but many people also require medication or insulin. Gestational diabetes. Gestational diabetes occurs during pregnancy and usually revolves after childbirth. It increases the risk of developing type 2 diabetes later in life. Signs and symptoms of diabetes. 1. Frequent urination, polyuria. High blood sugar levels cause excess glucose to spill into the urine, leading to frequent urination. Increased thirst, polydipsia. As the body loses more water through urination, patients often feel very thirsty. 3. Unexplained weight loss. Despite eating normally, patients with type 1 diabetes may lose weight as their body starts breaking down fat and muscle for energy. 4. Extreme hunger. Hypophagia. Sorry, I can't pronounce that one. The body isn't able to use glucose for energy, causing hunger. Signs and symptoms of diabetes also. 1. Fatigue, lack of energy from glucose can make people feel tired. 2. Blurred vision. High blood sugar levels can affect the eyes, causing blurred vision. 3. Slow healing sores or frequent infections. Poor blood circulation and high blood sugar can impair healing and the immune response. 4. Tingling or numbness in the hands and feet, especially in type 2. This is a sign of nerve damage or neuropathy, a common complication of long-term diabetes. Complications of diabetes. Diabetic ketoacidosis, DKA, more common in type 1. DKA is a life-threatening condition where the body breaks down fat for energy, producing harmful ketones. Signs include fruity smelling breath, confusion, vomiting, and severe fatigue. Immediate medical treatment is required. Heart disease and stroke diabetes significantly increases the risk of cardiovascular issues due to high blood sugar damaging the blood vessel. Kidney damage, neuropathy. Long-term high blood sugar can damage the kidneys, leading to kidney failure. Patients may require dialysis. Nerve damage, neuropathy. High blood sugar can cause damage to the nerves, leading to pain, tingling, or loss of sensation, especially in the feet. This increases the risk of infections and amputations. All right. Eye problems, retinopathy. Diabetes can damage the small blood vessels in the eye, leading to blindness if untreated. Foot problems. Poor circulation and nerve damage can result in foot ulcers, infections, and in severe cases, amputation. Treatments of diabetes. Type 1 diabetes. Insulin therapy. Patients need daily insulin injections or an insulin pump. Monitoring blood sugar levels throughout the day is crucial. Diet and exercise. A balanced diet and regular physical activity help regulate blood sugar. Type 2 diabetes. Lifestyle changes. Weight loss, a healthy diet, and regular physical activity can improve insulin sensitivity and help control blood sugar. Oral medication. Drugs like metformin help the body use insulin more effectively. Insulin. Some patients with type 2 diabetes may eventually require insulin therapy. Blood glucose monitoring. Patients use glucose meters or continuously glucose monitors, CGMs, to check their blood sugar levels regularly. Dietary management. Patients should follow a diabetic-friendly diet that includes low glycemic index food, fiber-rich vegetables, lean proteins, and healthy fats. Carbohydrates continuing is often recommended. Okay. Regular physical activity. Exercise helps the body use insulin more efficiently and reduces blood sugar levels. Foot care. Proper foot care, including regular inspections and wearing proper footwear, is essential to prevent infections or ulcers. Blood pressure and cholesterol control. Managing these through diet, exercise, and medication helps reduce the risk of complications. Note of CNA role of CNAs in diabetic care. Monitoring blood sugar levels. CNAs may assist patients in checking their blood glucose levels and report abnormal readings to nurses. Recognizing signs of hyperglycemia, low blood sugar. Early signs include sweating, shakiness, confusion, and dizziness. Severe hypoglycemia can lead to unconsciousness, and it's important to respond quickly by giving a fast acting sugar source like juice or glucose tablets if the patient is alert. Promoting a healthy lifestyle. Encouraging patients to stay active, eat healthy meals, and maintain proper foot care. Recognizing early signs of complications. As CNAs, you're often the first to notice changes in patients' conditions. Report any signs of infection, poor circulation, or abnormal blood glucose levels to your nurse immediately. All right. This is you get ready for your prep test, caring for diabetic patients. Get ready for your practice test on caring for a patient with diabetes. This review will cover essential diabetes care, including blood sugar management, recognizing symptoms, and understanding key treatments. Focus on identifying complications like diabetic ketoacidosis and hyperglycemia. All right, you guys, give me a thumbs up if you are ready for your practice quiz. Give me a thumbs up if you are ready. Give you guys a few. Give me a thumbs up if you are ready. All right, let's get ready. All right. Let's get ready. And I'm actually going to. Hi, you guys. All right, let's go. What is the primary role of insulin in the body? Is it A, to increase blood sugar levels? B, to help glucose enter the cells? C, to break down fats? D, to store proteins? Question 1. What is the primary role of insulin in the body? Is it A, B, C, and D? Let's drop those answers in the chat. Okay. All right, let's get those answers in the chat. All right, you guys, let's go ahead and reveal the answer. If you chose answer B, you are absolutely correct. To help glucose enter the cells, insulin allows glucose to enter the cells where it can be used for energy. Without insulin, glucose stays in the blood, causing high blood sugars. Way to go, you guys. If you chose B, you are absolutely correct. Way to go. Way to go, you guys. All right, let's move on to number 2. Which of the following is a common symptom of hyperglycemia? Shakiness, sweating, frequent urination, or low energy? A, shakiness, B, sweating, C, frequent urination, D, low energy. Which one do you guys think it is? A, B, C, or D? A, B, C, or D? All right. Okay, let's go ahead and reveal the answer. All right, if you chose C, you are absolutely correct. Frequent urination. High blood sugar levels cause the body to try to remove excess glucose through urine, leading to frequent urination. All right, let's go. Way to go, you guys. You guys are doing good. All right, type 1 diabetes is best described as A, the body's inability to use insulin properly. B, a condition where the body does not produce insulin. C, a temporary condition during pregnancy. D, insulin resistance due to obesity. Which one do you guys think it is? A, B, C, or D? A, B, C, or D? Jot those answers in the box. Drop those answers in the box. Give you a few, drop those answers in the box. All right, let's go ahead and move on. If you chose B, you are absolutely correct. A condition where the body does not produce insulin. In type 1 diabetes, the pancreas does not produce insulin, requiring lifelong insulin therapy. Way to go, guys. Oops, sorry. Sorry about that, guys. I showed y'all the answer. Sorry. Which type of diabetes is most commonly linked to lifestyle factors such as obesity and inactivity? Is it A, type 1 diabetes, B, gestational diabetes, C, type 2 diabetes, D, juvenile diabetes? A, B, or C, or D? A, B, C, or D? All right, let's drop those answers in the chat. All right, let's go ahead and reveal the answer. If you chose C, you are absolutely correct. Type 2 diabetes. Type 2 diabetes is often associated with lifestyle factors, including obesity, poor diet, and lack of physical activity. All All right. A patient with diabetes complains of blurred vision. What could this indicate? A. Low blood sugar. B. Nerve damage. C. Dehydration. D. High blood sugar levels. Let's get those answers in the chat. A, B, C, or D. A, B, C, or D. Let's see. A, B, C, or D. All right, let's go ahead and reveal the answer. If you chose D, you are absolutely correct. High blood sugar levels. High blood sugar can affect the small blood vessels in the eyes, leading to blurred vision. All right. Let's see. All right, we're going to move right along. Which is a common complication of long-term uncontrolled diabetes? A, stroke. B, liver disease. C, anemia. D, appendicitis. A, stroke. B, liver disease. C, anemia. D, appendicitis. Let's see. Which one do you think it is? Which one do you think it is? My YouTube is running a little behind. All right, let's go ahead. If you chose A, stroke, you are absolutely correct. Uncontrolled diabetes increases the risk of cardiovascular issues, including stroke and heart disease due to damaged blood vessels. All right. Which of the following is not a typical symptom of hyperglycemia? A, shakiness. B, sweating. C, confusion. D, frequent urination. Which of the following is not a typical symptom of hypoglycemia? A, shakiness. B, sweating. C, confusion. D, frequent urination. Give you guys time to get those answers in. Give you guys time to get those answers in. A, B, C, or D. If you chose D, frequent urination, you are absolutely correct. Frequent urination is a symptom of hyperglycemia, not hypoglycemia. Hypoglycemia symptoms include shakiness, sweating, and confusion. Way to go, guys. How should CNAs respond when they notice early signs of hypoglycemia in a patient? A, encourage the patient to drink water. B, give the patient a fast-acting sugar source. C, have the patient take more insulin. D, wait and reassess in 30 minutes. How should CNAs respond when they notice early signs of hypoglycemia in a patient? A, B, C, or D? Which one do you guys think it is? A, B, C, or D? All right, we got a lot of B's. Okay, I got an A one coming in. B. All right, let's go ahead and reveal the answer. If you chose B, you are absolutely correct. Give the patient a fast-acting sugar source. Provide a fast-acting sugar source like juice or glucose tablets to quickly raise blood sugar. Remember, CNAs must inform the nurse and obtain an order before administering any fast-acting sugar. Patient with severe hypoglycemia may need IV dextrose for treatment. All right, way to go, you guys. Diabetic ketoacidosis, DKA, is most commonly seen in A, type 1 diabetes, B, type 2 diabetes, C, gestational diabetes, or D, prediabetes. Is it A, B, C, or D? Let's get those answers dropped in the chat. Let's get those answers dropped in the chat, you guys. A, B, C, or D? All right. Let's reveal the answer. If you chose A, you are absolutely correct. Type 1 diabetes. DKA is more common in type 1 diabetes and occurs when the body starts breaking down fats for energy, producing harmless ketones, I'm sorry. All right. A patient with type 2 diabetes is likely to be treated with A, only insulin, B, only lifestyle changes, C, oral medication, lifestyle changes, and possible insulin, D, surgery to remove part of the pancreas. A patient with type 2 diabetes is likely to be treated with A, only insulin, B, only lifestyle changes, C, oral medication, lifestyle changes, and possible insulin, D, surgery to remove part of the pancreas. Which one do you think it is? A, B, C, or D? You guys could drop those letters in the chat to let me know what you think, what the answer is. All right, let's move right along. Let's go ahead and reveal the answer. If you chose C, you are absolutely correct. Oral medication, lifestyle changes, and possibility insulin. Type 2 diabetes is often treated with a combination of lifestyle changes, oral medication, and sometimes insulin. Way to go, guys. Which of the following is a long-term complication of poorly managed diabetes? A, nerve damage, B, vision improvement, C, increased immunity, D, faster wound healing. Which of the following is a long-term complication of poorly managed diabetes? Is it A, nerve damage, B, vision improvement, C, increased immunity, D, faster wound healing? A, B, C, or D? Which one do you guys think it is? All right, let's go ahead and reveal the answer. A, nerve damage. If you chose A, you are absolutely correct. Poorly controlled diabetes can lead to neuropathy or nerve damage, especially in the feet. All right. A key dietary recommendation for a person with diabetes is A, high sugar intake, B, low fiber intake, C, low glycemic index food, D, high-fat diet? Is it A, B, C, or D? Drop those letters in the chat and let me see what your answer is. All right, let's go ahead and reveal the answer. If you chose C, you are absolutely correct. Low glycemic index food. Low glycemic index foods help control blood sugar levels by preventing spikes in blood glucose. How does regular physical activity benefit diabetic patients? Is it A, it lowers blood sugar by increasing insulin sensitivity? B, it reduces the need for insulin? C, it stops the progression of diabetes completely? D, it allows patients to eat more sugar. How does regular physical activity benefit diabetic patients? Is it A, B, C, or D? Drop those answers in the chat, you guys. Drop those answers in the chat. Let me know what it is. All right, let's go ahead and reveal the answer. If you chose A, you are absolutely correct. It lowers blood sugar by increasing insulin sensitivity. Regular exercise helps the body use insulin more efficiently, lower blood sugar levels. What is one of the first signs of diabetic neuropathy? A, muscle spasms. B, tingling or numbness in the feet. C, hair loss. D, frequent headaches. What is one of the first signs of diabetic neuropathy? A, muscle spasm. B, tingling or numbness in the feet. C, hair loss. D, frequent headaches. What do we have? Drop those answers in the chat and let me know what you have. Let's go ahead. All right, let's go ahead and reveal the answer. If you chose answer B, you are absolutely correct. Tingling or numbness in the feet. Diabetic neuropathy often starts with tingling or numbness in the extremities, particularly in the feet. Way to go, guys, if you chose B. What is the primary treatment for type 1 diabetes? Is it A, oral medication? B, lifestyle changes? C, insulin therapy? D, surgery? What is the primary treatment for type 1 diabetes? Is it A, B, C, or D? All right, drop those answers in that chat. Let me know what your answer is. Way to go, guys. All right, let's go ahead and reveal the answer. If you chose C, you are absolutely correct. Insulin therapy. Type 1 diabetes requires daily insulin therapy because the body does not produce insulin. Way to go, guys. If you chose C, way to go. Foot care for diabetic patients is important because A, they are more likely to injure their feet. B, poor circulation and nerve damage increase the risk of foot ulcers. C, diabetes increases foot hair growth. D, feet are more prone to fungal infections. A, B, C, or D? Foot care for diabetic patients is important because. Drop those answers in the chat and let me know what you think. And by the way, you guys, happy Monday. Happy Monday. I hope everybody had a wonderful weekend. Sorry about that. Happy Monday, everybody. Happy Monday. All right, let's go ahead and reveal the answer. If you chose B, you are absolutely correct. Poor circulation and nerve damage increase the risk of foot ulcers. Diabetic patients often have poor circulation and neuropathy, which increases the risk of foot injury and slow healing ulcers. All right, you guys, let's move it right along. A key feature of gestational diabetes is A, it occurs after childbirth. B, it is linked to obesity. C, it usually revolves after pregnancy. D, it is a permanent condition. A, B, C, or D. A key feature of gestational diabetes is A, B, C, or D. All right, guys, I'm going to drop those answers in the chat, and I'm going to go ahead and reveal the answer. If you chose C, you are absolutely correct. It usually revolves after pregnancy. Gestational diabetes occurs during pregnancy and typically revolves after the baby is born, although it increases the mother's risk of type 2 diabetes later in life. Which of the following is a non-medication treatment for type 2 diabetes? A, insulin injections. B, bariatric surgery. C, diet and exercise. D, dialysis. Which of the following is a non-medication treatment for type 2 diabetes? A, B, C, or D? All right, let's go ahead and reveal the answer. All right. If you chose C, you are absolutely correct. Diet and exercise. Diet and exercise are the first line of treatment for type 2 diabetes, helping patients manage blood sugar levels. What is the significance of blood glucose monitoring? A, it prevents all diabetic complications. B, it helps adjust insulin doses and manage diabetes. C, it replaces the need for insulin. D, it is only required in severe cases of diabetes. What is the significance of blood glucose monitoring? A, B, C, or D? All right, let's go ahead and reveal the answer. If you chose B, you are absolutely correct. It helps adjust insulin doses and manage diabetes. Regular blood glucose monitoring is essential for adjusting treatment and managing blood sugar levels. Which of the following is an example of fast-acting carbohydrate that can be given during hypoglycemia? A, protein shake. B, a glass of juice. C, chicken soup. D, a slice of cheese. All right, which one do you guys think it is? A, B, C, or D? You can drop your answer in the chat. Drop your answer in the chat. All right, let's go ahead and reveal the answer. If you chose B, you are absolutely correct. A glass of juice. Juice contains fast-acting carbohydrates that can quickly raise blood sugar levels during hypoglycemia? Diabetic patients are advised to check their feet regularly because A. Diabetes can cause foot hair loss. B. It helps regulate blood sugar levels. C. Diabetic makes the foot larger. Diabetes, I'm sorry. D. Small injuries can go unnoticed due to nerve damage. Which do you think it is? A, B, C, or D? A, B, C, or D? All right, let's go ahead and reveal the answer. If you chose D, you are absolutely correct. Small injuries can go unnoticed due to nerve damage. Nerve damage, neuropathy, can make it difficult for diabetic patients to feel injuries, increasing the risk of infections and ulcers. Which of the following is a common cause of hyperglycemia in diabetic patients? A. Eating too much protein. B. Overdosing on insulin. C. Missing insulin doses. D. Exercising. Which of the following is a common cause of hyperglycemia in diabetic patients? A. Eating too much protein. B. Overdosing on insulin. C. Missing insulin doses. D. Exercising. Drop those answers in the chat and let me know what you think it is. A, B, C, or D. All right, let's go ahead and reveal the answer. If you chose C, you are absolutely correct. Missing insulin doses. Missing insulin and or diabetic medication can cause blood sugar levels to rise, leading to hyperglycemia. In the early stages of diabetic renopathy, a patient may experience A. Blurry vision, B. Loss of color vision, C. Night blindness, D. Complete vision loss. A, B, C, or D? Let's see. Drop those answers in the chat. And let's see what you have. All right, let's go ahead and reveal the answer. If you chose A, you are absolutely correct. Blurry vision. Diabetic retinopathy affects the blood vessels in the eyes, often causing blurred vision in the early stages. Which of the following symptoms would indicate diabetic ketoacidosis, DKA? A fruity smelling breath. B. Low blood sugar levels. C. Sweating and shakiness. D. Cold hands and feet. A, B, C, or D? Drop your answers in the chat. Which do you think it is? A, B, C, or D? All right, let's go ahead and reveal the answer. If you chose A, you are absolutely correct. Fruity smelling breath. Fruity smelling breath is a sign of ketones in the blood, which is a characteristic of diabetic ketoacidosis. The CNA notices that a diabetic patient has a small cut on their foot. What should the CNA do? A. Wash the cut and apply a bandage. B. Report it immediately to the nurse. C. Ignore it since it's a minor injury. D, have the patient apply their own bandage. Which one do you think it is? A, B, C, or D? A, B, C, or D? All right. Let's go ahead and reveal the answer. If you chose B, you are absolutely correct. Report it immediately to the nurse. Even small foot injuries in diabetic patients can lead to serious complications, so the nurse should be notified immediately for proper care. All right, you guys, keep up the great work. Comment, like, share, subscribe. I am Phyllis, and I do provide online CNA and CMA exam prep services for Florida Training Academy. If you have any additional questions, please feel free to email us at admin@fltrainin.com, admin@floridatraining.com. Keep up the great work, you guys. If you have any questions, please email us, and don't forget to comment, like, share, and subscribe. Once again, my name is Phyllis. Happy Monday. You guys have a great rest of your evening. You're welcome. Bye-bye. And don't forget to look online to see when I'll be on next as well. Good night, you guys.